This is Dr. Victor bringing you latest update from the highlights of ESC Congress 2021. The first topic is emperor-preserved heart failure. The results from the emperor-preserved trial were presented by Professor Stefan from Berlin in a hotline session on 27th August. This international double-blind trial enrolled 5,988 symptomatic heart failure preserved ejection fraction patients with and without type 2 diabetes who had elevated pro-BNP of more than 300 in patients without atrial fibrillation and more than 900 in patients with atrial fibrillations, along with evidence of structural changes in the heart or documented history of heart failure hospitalization. Participants were randomized 1:1 to receive empagliflozin 10 mg daily or placebo. The primary endpoint was a composite of CV death or hospitalization for heart failure. The first secondary outcome was heart failure hospitalization, including first and recurrent events, while the second secondary outcome assessed the rate of decline in estimated glomerular filtration rate during study treatment. Average age of participants was 72 years, 45% were women, and average LVEF was 54%. During a median follow-up of 26 months, a primary outcome event occurred in 13.8% patients in the empagliflozin group and in 17.1% in patients in placebo group. In placebo group, the hazard ratio of 0.79 indicating significant risk reduction of 21%. The effect on the primary outcome were observed across all pre-specified subgroups, including patients with or without type 2 diabetes and those with LVEF of less than 50%, 50 to 60%, or more than 60%. The secondary outcome, the total number of heart failure hospitalization, was lower with empagliflozin than with placebo, indicating significant risk reduction of 27%. Furthermore, the rate of eGFR decline was slower with empagliflozin than placebo. Regarding safety, serious adverse events occurred in 47.9% of patients in the empagliflozin group and 51.6% in the placebo group. Adverse events leading to discontinuation of treatment occurred in 19.1% of patients in the empagliflozin group and 18.4% in the placebo group. Uncomplicated genital and urinary tract infection and hypotension were more common in patients treated with empagliflozin. Empagliflozin convincingly reduced the combined risk of CV death or hospitalization for heart failure in patients with preserved ejection fraction with or without type 2 diabetes.